All right, welcome back. And we're going to do chapter 3 today. This is going to be a longer lecture. There's a lot of material that I want to make sure that I talk a little bit about, even though the book covers it pretty well. And again, I have some differences about uh, uh, with my perspective about how some of this material should be interpreted. But generally speaking, there's a lot of data here that I don't disagree with. Anytime we talk about, hey, Medicare was passed in 1965. Well, there's really nothing to be discussed there. Why Medicare was passed and how it was passed is more of a subjective discussion. And so I'm going to add some of my own perspective on a number of these things. I'm going to spend a little less time obviously advocating for a national health system the way that your textbook does. I'm not a fan of that idea, and in case you haven't figured that out yet. And so I'm going to present some alternative perspective. And then you, as I've been saying so far, you need to kind of apply your own judgment. And maybe at the end of this course, you're going to be totally sold on a national health system, and you'd like to see us adopt the system that Great Britain has. Or maybe you'll be more convinced that we should have national health insurance like Canada does, or that we should have a socialized health system the way that Germany and Singapore do. Or maybe you think we should have, build on what we already have in the United States and free the market to do what it does best, which is provide low cost, high quality products to everyone. So, all right, without further ado, let's get into the slides. So here we go. I'm going to share my screen here, and then I'm going to launch. So this is the evolution of health services in the United States. And so your textbook talks a little bit about where this comes from and the cultural, sociocultural aspects. So absolutely. Health is a cultural thing. We talked last time about disease and illness and how those two things are grounded in culture. And if health is cultural, then healthcare, of course, is cultural as well, because healthcare is the treatment of disease and the perspective on disease and illness. And so if disease and illness are cultural, then is the treatment of those things. You're not going to treat something you don't believe in. Healthcare is an economic good, right? How disease is treated depends on the resources available to a society. So if you travel to a poor society, so I spent some time talking with a physician, a colleague of mine who did when she was in college, spent a summer working with Mother Teresa in India. And, basically what she did for a long period of time was work in the house of the dying, and these were basically people were just brought there to die. They had the society was not wealthy enough to treat their illnesses, and was not wealthy enough to provide the kind of care that we would expect in the United States. And so they had somewhat squalid conditions. And, my friend and the people that worked in the organization did their best to provide the care that they could. But when you are operating at as low an income as Mother Teresa's organization operated in, you have very limited ability to provide the kind of care that we would perceive in the United States as being baseline. So a common mistake that I think is made in healthcare policy discussions is comparing what you actually have with an ideal rather than comparing what you have with what is possible. So it isn't possible to install a U.S. level of technology and care in a developing country. They just don't have the wealth to do it. And so that's just a reality. So, we can talk about ideals in terms of what we'd like to have, but we want to maintain a high level of realism. And so we have to remember that healthcare is an economic good, and healthcare expenditures compete with all the other expenditures like food and shelter and education and, other pleasurable things like being able to take a vacation, right? So these are, the more you spend on health, the less you can spend on anything else. Okay, now healthcare delivery is historical. No delivery system just fell out of the sky and was fully formed. So delivery systems emerge and change with changes in culture, technology, and wealth. So I'm going to talk a little more about that. So which dominates, culture or history? Your textbook kind of implies it's culture. Of course, you can't separate culture and history from each other. They are intertwined, and I would argue that so is healthcare. So I wanted to kind of compare the US and UK because the UK has the national health system that your book so admires. And so let's talk a little bit about, between these two. So we have the UK national government run health system. Everything from financing is financing at the government level by taxes, right? Insurance is kind of non-existent because the government just gives you whatever it decides you're going to get. Delivery is done by the government, and then payment is also done by the government to itself through the budgeting process. In the United States, we have a mixed private-public healthcare system. So if you're lucky enough to make it to 65, you get Medicare. If you are poor, you might get Medicaid. If you're like me and you retire from the military, or you're a military member or you retire from the military, you might get TRICARE. But most people get their healthcare through the private financing. So you pay out of pocket, either you and your employer finance your care. You purchase insurance between you and your employer if you have an employer-based insurance. Your delivery of care is mostly from private, either for-profit or not-for-profit entities. Remember, all physician offices, or virtually all physician offices, are for-profit entities, though some, like, for example, Core Physicians in Exeter, for those of you who are from around here, is a not-for-profit organization that employs its physicians. So you have delivery from private entities, and then you have payment between your insurance company and the private delivery system. So it's very different, right? And yet we have deep similarities. U.S. culture is largely a outgrowth from its colonial past with the United Kingdom, right? Our legal system is very similar to the United Kingdom. The men who wrote our Constitution were largely influenced by the culture and legal system of the United Kingdom, though they were also reacting against it. Another important point that I made last time was the scale of the United States, both in terms of size, right? These do not do justice in terms of, these maps don't do justice in terms of the relative scale. The United States is an enormous physical space, right? And then we have, like I said before, somewhere in the 5 to 6 times as many people in the United States, which makes it a far more complex system. All right, I want to do a little bit of kind of political history here. So this is a quote from David Hume, who is a Scottish philosopher and has had a lot of influence on political philosophy, and he had a significant impact on the thinking of our founders. And I want to kind of highlight this one section here, and you can read the rest later. In contriving any system of government and fixing the several checks and controls of the Constitution, every man ought to be supposed a knave and to have no other end in all his actions than his private interest. So that's a little bit of kind of stilted 18th century language, but what he's basically saying is human beings tend to be selfish, right? And when you build a government that's going to be run by human beings, you ought to assume that the people who are drawn into positions of power are selfish individuals, because human beings on average are pretty selfish and they will use power to their own advantage. So you have to build a constitutional structure that will assume that the actors who are filling the positions in government are self-interested actors. So to see how this was, how this influenced our own founding, James Madison, one of the founders and one of the authors of our Constitution, writes in the Federalist Papers number 51. So this is a series of papers written by James Madison, Alexander Hamilton, of the late play or musical, and I forget the third individual off the top of my head. Maybe I'll look it up later. But he writes, if men were angels, no government would be necessary, right? So he's just totally, drawing on Hume and Hume's kind of thinking. If angels were to govern men, neither external nor internal controls on the government would be necessary. So if we were all angels, we wouldn't need government. If we could ensure that angels were put in to run our government, then we wouldn't have to worry about the structure of the government. However, in forming a government which is to be administered by men over men, the great difficulty lies in this. You must first enable a government to control the governed. So you're going to make a government that's going to be run by fallible, self-interested men to oversee fallible, self-interested men and women. They're writing men here. Because this is the 18th century, you must first enable the government to control the governed. So you have to give the government a whole bunch of power. And in the next place, you have to make the government, in the next place, oblige it to control itself. So the problem here is, now that you've given the government all this power, how do you make sure it doesn't abuse this power? And that's really a critical problem that we've seen throughout the course of human history, right? Most governments throughout history were predatory entities that basically existed to extract wealth from the average citizen. So a dependence on the people is no doubt the primary control on the government, but experience has taught mankind the necessity of auxiliary precautions. So what does that last sentence mean? He's saying, basically democracy is really a good idea because you can vote the bums out, but we need to put a structure in place that balances power between the different aspects of government. So we have a kind of a government that's designed by Madison and company, right? That has three competing components. You have Congress, you have the presidency, so the executive, so you have the legislative, the executive, and the judiciary. And the three of those entities are meant to kind of fight each other and for power. And in that sense, in addition to the democratic process of electing our officials, this competition between the different parts of government is supposed to kind of keep them checked in place. So the last quote I want to use is from the 20th century, and I like this quote because it says it in a much more concise, modern sense. A fundamental political dilemma of an economic system is this: a government strong enough to protect property rights and enforce contracts is also strong enough to confiscate the wealth of its citizens. So Weingast, well-known political scientist, is saying basically the same thing that Madison and Hume were saying is, we're going to turn over all this power to the government in order for it to protect us. But once we've turned over all this power to the government, how are we going to keep it from turning into a monster and taking advantage of us? So these are the founding ideas that undergird the United States, its constitution, and its culture, right? A deep suspicion of government. That's a major reason why we don't have a national health system, a national health insurance system, right? What we are contending with here is a fundamental, like in our DNA, a resistance to centralized authority. And so that's kind of, so I agree with the text in that sense that there is a cultural component that is keeping a national health system from coming into place. I happen to think it's a good thing that it hasn't come into place. But this is the cultural component. So I want to keep talking a little bit more about culture, and um, and here I want to talk about Hofstede's dimensions of national culture. So this is not, again, also not in your text. So this is, I would like you to be familiar with this. I have a website down here that explains each of these in some detail. Um, Hofstede is a management thinker. So again, I'm a management guy, so I'm familiar with his work. It's a little dated. He did most of his research in the 70s, and he came up with these 6 dimensions of national culture, and they're still pretty well used today. It's a popular. It's still popular in the business literature, and it is a useful lens for thinking about culture. And one of the things I'd encourage you to think about is the United States is this huge melting pot of all these different cultures. I'm a Italian. My father came over from Italy. My grandmother, her family came from Poland. My grandfather came from France. My other grandfather came from France. I'm a first or second generation on one side or the other. I have mostly European background, but those countries are very different culturally, and what your background is probably different, almost certainly different than mine, probably most of you. um, uh, uh, and maybe you have an Asian background or an African background, right? But certainly, or a South American background, which then traces mostly, either to an indigenous peoples or back to Europe, most likely. But what we have in the United States is a blending together of people from all over the world, right? Whose cultures and family cultures are influenced by their origin stories. And so it's useful to think about the United States in this kind of agglomeration, right? We're going to throw it all together in this melting pot idea, right? We're going to throw it all together in one big bucket. But in reality, the United States is a whole bunch of different cultures. And if you haven't had the chance yet, I've lived all over the United States thanks to my time in the Army. Spent a lot of time in the South, spent some time in the West. Got a chance to live in Hawaii, and got a chance to see just how many different cultures there are in the United States. And then I didn't get to see all of them, but life in Louisiana is very different than it is in Denver, Colorado, than it is in Boston, Massachusetts, than it is in Honolulu, Hawaii. Um, Trust me. And if you haven't, and hopefully you'll get a chance to see some of that. So let me talk about these 6 dimensions, and then we'll look at them, cross-culturally. So power distance. The question of power distance is, in a culture, how striated or stratified is a culture, right? So you think about like the caste system in India, for example, where you have a very hard system of class, or in kind of classic UK, class is a big deal in the UK. Um, uh, uh, you can think about it in terms of race in the United States. We talk a lot more about race rather than class in the United States. And are we okay with this or not? So that's kind of the question. So A, is there a lot of stratification in your society? And B, is that expected and understood to be the way it's supposed to be? Individualism versus collectivism. This one's important, really important for healthcare, though power distance is too. Because if you think about this, like when you go to see the doctor introduces himself as Dr. Smith, right? And they're wearing a white lab coat and a bunch of social cues that tell you that this person is a cultural authority, and you are supposed to uh, 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 kind of subordinate yourself to her or his status, right? So that's an example of power distance in healthcare. Individualism versus collectivism has a lot more to do with the health policy world, right? Do we see ourselves first and foremost as individuals, or do we see ourselves as part of a larger collective, right? So Asian cultures tend to be a lot more collectivist than Western cultures are, seeing themselves as part of a family first and then as an individual. Whereas in the United States, particularly, we tend to see ourselves as individuals first, then part of a family, then part of a larger community. Masculinity versus femininity. We're talking about masculine values, aggressiveness, competition versus femininity, classified as um, cooperation and uh, and supportiveness, right? And old-fashioned, maybe, but you can read the definitions. Uncertainty avoidance. We want to know exactly what's coming, or not, or are we comfortable with kind of uncertainty? And bear in mind, all these things vary from person to person too, of course. What Hofstede tries to do is kind of get a sense of a national culture. Um, uncertainty avoidance. How much are you a planner, and how much do you want to know what's going to happen tomorrow versus you're kind of a woohoo kind of person and you do, whatever comes is good for you. And they're kind of cultures, national cultures that where everyone leans a little more one way or the other. Long-term orientation versus short-term orientation. So if you're a long-term orientation, you tend to be a little more conservative. If you are short-term orientation, you're a little more progressive. So long-term orientation, you like to see things, you rely on uh, institutions that have been around for a long time, versus short term, you're more progressive minded. You don't mind cultural change. And then indulgence versus restraint. So this is indulgence is you only live once. Restraint is you hold back on expressing your personal desires and needs. Right. Um, so in the United States, the way Hofstede scores the United States, very low on power distance, not the lowest, but low on power distance. So where we do have a class society, we do have stratification around race and class and socioeconomic status, but we tend to we don't look at it as okay, right? As a society, we don't say, um, you know, poor people should stay down and rich people should stay up, and that's how it should be, right? We tend to be much more a fan of change in that sense. Individualism, we score very, very high in individualism. Masculinity, we lean a little more towards that kind of aggressive, and it fits with the individualism, aggressive, individualistic activity. We are low on uncertainty avoidance. I'm surprised this isn't lower. The United States has a entrepreneurial, go west, young man kind of culture. So I'm surprised this isn't a little lower. I was also surprised to see the United States ranked relatively more long-term oriented, more oriented towards culture. Um, cultural institutions. And I guess that makes sense because the United States has one of the largest uh, 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 or highest percentage of people who attend church. So if you attend church, you are going to tend to be a little more conservative. So the United States is a more conservative country. Um, though you wouldn't know that from the fact that we have a relatively high level of indulgence. So these two things kind of run. And so when you think about the interaction between these six items, you get a flavor for some of the contradictions in the United States and the United States culture. Now, why am I talking about this? Let me remind you, the idea here is health and health care is a cultural phenomenon, right? And so how health is perceived and how healthcare is delivered, again, is based on culture. So I thought we'd compare the UK and the US using Hofstede's numbers, and check this out. It's a lot of similarity here, right? Well, that makes a lot of sense because of the cultural overlap between the two societies. very similar in power distance. I'm a little surprised. The UK actually is lower in power distance. I would have thought they'd be higher. I have not spent much time in the UK. I've visited a few times, but so I don't know that culture that well. My gut would have been that it would have been higher. But similar in individualism, similar in masculinity, similar in uncertainty avoidance. Though UK is actually lower than the US, which surprises me there too. And you would think with higher uncertainty avoidance, you would be more inclined to have a national health system or a national health insurance plan, right? Because the less you like uncertainty, the less comfortable you are with uncertainty, the more certainty you want. And so what's the best way to get that? Well, to get the government to run everything, right? And so you would think, so given their relatively low level of uncertainty, it's kind of surprising that, uncertainty would drive, or a lower uncertainty would have one of the most kind of robust government-run health systems. And then long-term orientation, again, I'm surprised the UK is lower than the United States, or less long-term, so less conservative, more progressive than the United States. And then we're about the same in indulgence. So very similar culturally, right? So the reason I'm showing you this is because it's hard to make an argument that the UK has a national health system, one of the most robust government programs, and the US doesn't, based on culture, given how close our cultures actually are, right? Compare now to Germany. We have a lot more differences with Germany, much higher in individualism than Germany is. So we're purple, US, the Germans really don't like uncertainty. They're they're much more progressive than we are. And then we are much more indulgent than they are. So here's where you would see, and now Germany has socialized insurance, right? Where where the individuals and firms finance. Insurance is private, but mandated by the government. That's the main characteristic of socialized insurance, right? Payment is through the insurance company, and delivery is mostly private. So it's not, unlike the UK where, you go to a hospital, it's mostly a government hospital staffed by government employees. If you go to the hospital in Germany, it's going to be a private hospital staffed by people who are employed in the private sector. So you would have thought that if it was pure culture that explains the difference, then it wouldn't be, this pure culture using Hofstede's measures doesn't explain why the US and the UK have such different health policies. So I want to talk a little more about history for a minute, because my argument would be, rather than culture, it's much more about history. So looking at history broadly, and this is where I want to kind of return, this is me as an economist talking to you, going back to the year 1000. So this goes back to the year 1000. What we see here is the average gross domestic product per capita. So remember, I talked last time about gross domestic product is the amount of money spent in a society. So gross domestic product per capita is the amount of money spent in a society in a given year divided by the number of people in the society. So we see, if we go back to like the year 1000, so 1,000 years ago, gross domestic product per person, or the amount of resources per person, was hovering around a few $100s a year. And it stays that way for hundreds and hundreds of years, all the way through the Dark Ages, into the Renaissance, until we arrive at the Enlightenment, right? So through the Renaissance, into the Enlightenment, The Enlightenment is this period of kind of movement away from, so the Renaissance is the return to classical learning. So through the Middle Ages, we have truth is handed down by the church, right? You go to your clergy person who tells you how you should live, and would in particular tell you what health is and what disease is, right? All of that would have been handed to you by the church. Your priest would have known that from his study of the Bible. And so very little changes because there's very little emphasis on technology or science. Science basically ceases to exist during this period. And it's only in the Renaissance that we begin to rediscover in the West Plato, Aristotle, right, and some of the Greeks who were scientists and philosophers. And there's a rebirth of interest in science. And science really takes off as we transition from the Renaissance into the Enlightenment. And the Enlightenment begins in the 1700s, and Hume is part of the Scottish Enlightenment. And this is when science takes over and reason versus inherited tradition takes over. And what we see happen is an explosion, first in the United Kingdom. The blue line here is the United Kingdom, an explosion of the application of science to create technology that makes farming more efficient, makes transportation more efficient, and also begins to improve healthcare. And what we see from the Industrial Revolution forward is this incredible amount of growth to where we are today, with the average GDP per capita in the United States is around $50,000 a year. So we see this enormous growth in terms of economic resources. So coming back to what I said before, you can't compare the US healthcare system to the health system that's in India, for example, because the amount of resources necessary to create the US healthcare system is far, far more than what India has available to it. So you can see India down here with a GDP per capita of around $7,000, as opposed to, the United Kingdom is around 40. The United States is closer to 50. So it's not possible to have the kind of healthcare that we have, or that most Western countries have, in a country that has as low a GDP per capita. All right, so now we're talking history. So we've been talking culture, now we're talking history. Something else that's important to realize. This data is from the World Bank, and it is the percent of people living at $1.90 a day. This is considered extreme poverty. $1.90 a day and this is not like my food desert experiment that you should have listened to. It's not just about food, right? It's $1.90 a day for everything, right? Imagine trying to live on $1.90 a day, using $1.90 a day to buy food, provide a place to live, buy clothing, right? And so on and so forth. And what you see is these people who are living on $1.90 a day are at serious risk of starvation, illness, disease, and death. And so back in 1981, the ratio just hovers a little higher than this, right? So if we go back far enough, it used to be like 80%. So at the turn of the 20th century, so going from the 1800s to the 1900s, right? So 1899, 1900, it was more like 75%. So over the 100 years of the 20th century, it fell from like 75% to, in the 80s, 40%. And then the last 40 years, it's hard for me to imagine the 80s were 40 years ago, but in the 80s, it fell from 42% in the 80s to today, it's below 9%, right? Think about that. 100 years ago, it was more like 80% of the world lived at near starvation. Today, less than 10% of the world lives at near starvation. So history, again. So what do we want from a healthcare system? Well, let me back up. So my argument is um, with uh, with healthcare, is it history or is it is it culture? So I would argue that the major differences between Britain and the United States are linked more to facts of World War II, right? Particularly healthcare, and the changes that happened after and around World War II. In the early 20th century, socialism was sweeping across Europe. We had the Russian Revolution, which is, Russia's kind of sort of part of Europe, kind of sort of part of Asia. But we had the Russian Revolution. World War II happened, and Russia became the Soviet Union, and was trying to impose itself on the rest of the world, basically impose communism on the rest of the world. So Great Britain being part of Europe, there was a much stronger push towards socialism in Great Britain. Also, Great Britain had its economy pretty much destroyed by World War II, whereas we lost a lot of men in the war, and we spent a lot of treasure on the war, but we weren't destroyed. Our industry wasn't destroyed the way England was. And so we had a fundamental break historically with England. And then on top of that, England or the UK after World War II lost many of its colonial possessions. And so it had a real change in culture and economic status. And so I would say it was much less about culture that the UK wound up with a national health system than it was about history and the forces of history, and the fact that the United States stayed wealthy through World War II, whereas England's economy was devastated along with the rest of Europe, by World War II. So very different circumstances that birthed the National Health Service in England versus what we have in the United States. So what do we really want from a healthcare system, though, right? So why are we talking so much about a government run, or how much should government control healthcare? My argument would be and I would like you to know this, the desired outcomes from a healthcare system are high quality, low cost, easy to access, coordinated, and patient-centered, right? So we want high quality, kind of speaks to itself. We want good doctors, good nurses, good hospitals that are safe and deliver high quality. We want it to be cheap. We want it to be able to easily access it. And low cost makes stuff easy to access, right? We want coordination between providers. This is a major problem in the United States, and frankly, it's a major problem even where you have nationalized or a heavy government hand. And I would say my personal experience in the military, having been inside of a government-run medical system for most of my adult life, and I still get most of my healthcare from a government insurance program. Coordination stinks. Just because it's run by the government doesn't make it good. I will share with you an article about a really tragic situation at Walter Reed back in the mid 2000s. I want to say about 2007. We had Walter Reed is the largest Army hospital and military hospital in the United States. And this was, during the height of the Iraq and Afghan wars. They were treating hundreds of severely injured individuals. And frankly, the coordination was terrible. And the soldiers who had been hurt were suffering for it. And there was a huge write-up in the Washington Post, and it was super embarrassing for the military, heartbreaking for me, because I was working in that area at the time. I was actually in the hospital I was working at was part of the Walter Reed larger kind of Walter Reed system. So we referred a lot of our patients there. So it was really just a tragedy to see. But the point I'm trying to make is just because it's run by the federal government doesn't mean that you're going to have all these outcomes that we would like to see. So these are the kind of core outcomes that we want. So the question is, does this imply that a healthcare system must also be government run? Can a free market provide these outcomes too? And so I'm asking you to listen to that interview with the Surgery Center of Oklahoma to get a sense of what a real free market um, provider looks like. And I would also encourage you to think about other industries. Food's pretty important, right? Is our food supply run by the government? Telecommunications, right? You've got I'm sitting here with my iPhone. You've got one, I'm sure, in your pocket or sitting on your desk next to you. Is this, would you be better off if it was run by the government? Entertainment, banking. So we could go on. All right. So I'm going to stop here. Break this lecture into two parts. When we come back, we'll talk about kind of outline some more of the book.